You're in the Evolving Practices in Coordinated Access Systems room, so just to let you know to make sure you're in the right space today. It has been, we're almost at the end of our conference, the end of the second day, and it's been a really empowering past couple of days, but I'm sure people are also a little bit tired, so thanks for tuning in here today. It's going to be a great session. Just before we start and introduce the topic and introduce our speakers today, just out of curiosity, by show of hands, you raise your hand if you don't know what coordinated access system is? Awesome, so everybody in the room does. Is there anybody in the room that's not currently using coordinated access in their community? A few people, so this will be a very interesting session, and there's questions and answers at the end of the presentations. So if you have a question for a particular presenter, maybe take a note of it, and at the end we'll do a Q&A. So I'm Dawn Whedon from the Canadian Alliance to End Homelessness, and I'm your moderator for today as well. Since 2018, the Canadian Alliance to End Homelessness has been supporting communities to implement coordinated access systems as just one of the key components in the local efforts towards reducing and ending chronic homelessness. Since 2019, the federal government has required that Reaching Homes communities implement the coordinated access system. So this session will highlight the importance and value of coordinated access, the benefits and limitations as well, and implementing realities and evolutions, like given the local coordinated access systems are constantly evolving and improving. Our presenters today will cover coordinated access systems that need a reset due to staff turnovers, systems that have matured and engaged additional system partners, systems performance management, and consideration for coordinated access implementation in rural, remote, and smaller communities. Resources as well to support continuous improvement of a coordinated access system will also be shared today. So I'll start by introducing all three of our presenters. We have right here to the right of me, Marie Morrison, and she'll be presenting on where would we be without coordinated access and the need for continuous improvement in coordinated access. Next to Marie, we have Ashley Saunders, and Ashley is going to be presenting on resilience in a changing system. And we have Sydney presenting as well, implementing coordinated access in smaller communities across Canada. So we'll get started with Marie. Thank you.
Thanks, Dawn, and welcome everyone. Again, my name is Marie Morrison. I'm the director of Built for Zero, and really happy to be here in Halifax, Kbuktuk. I'll just say you saw a little flurry up here. We were having a bit of trouble with our presentations not being loaded, so we may interrupt at some point to make sure they're all uploaded here, but we're going to get started. And just thank you, Dawn, for doing that little bit of an introduction, because what that tells me is there's lots of expertise in the room, and we're going to have lots of good conversation today after the presentations. So I am from the Canadian Alliance to End Homelessness. And Built for Zero that I work with is one of the initiatives of the Canadian Alliance, along with, of course, the conference, allied networks, our social enterprise training and technical assistance, and a lot of the policy and advocacy work that we do. And we have an operating theory at the Canadian Alliance about what it's going to take to have all communities in Canada achieve and sustain an equitable and measurable end to all homelessness. And these interrelated drivers include having local systems set up to drive and sustain reductions, having proven technical strategies implemented well at the program level, federal structural reform that supports an end to homelessness, provincial systems that support an end to homelessness, and key influencers that expect and demand that homelessness be ended. And underpinning all of this, of course, truth, reconciliation, diversity, equity, and inclusion. When we're talking about coordinated access, I think we're talking a lot about how are we setting up our local systems to drive and sustain reductions. And the goal, of course, is not just to manage homelessness differently, to develop another kind of wait list, but to use these tools and processes to develop local systems that are focused on solving homelessness. And organizing in this way helps us answer this fundamental question. Are all of our programs and investments adding up to the things we really want? Equitable reductions in homelessness over time? And if not, how quickly would we know, and how quickly could we pivot? So let's talk about what local communities look like before coordinated access. And I don't know how long some of you have been around. I worked in local community and was at a time when we were working hard to implement best practices and connect together. And we were connected, but we weren't coordinated, and we're going to talk about that. So I remember a time before coordinated access in our community and then what it looked like afterwards. So we'll call this before coordinated access, we'll call this the standard system. And in a standard system, there's no coordinated community coverage. We don't know if we're covering the whole community. There may be overlap in services. There may be missing areas. When we have a coordinated system, we're looking at having fully coordinated outreach and access points. Each program generally has its own intake or assessment. We're looking in coordinated to have one community-wide intake or assessment that everyone uses. We're asking the same questions. Each agency keeps its own list of clients versus having one community-wide by name list or unique identifier list. And the mentality tends to be my clients, my resources, rather than our clients, our resources. How are we taking all of the resources in our community, putting them in the middle of the table in benefit of all clients? Agencies and programs prioritize clients independently or simply use a first come, first serve approach to fill vacancies versus having a clear and rationalized community-wide prioritization protocol. And it tends to have a program-centric view, which we know is only going to be able to address homelessness. It is not until we come together that we have this opportunity for a system-level, client-centered view to end homelessness. So what does this look like at a client level? For folks that are trying to navigate a complicated system without coordinated access, having to tell their story multiple times, trying to figure out where to go, trying to figure out how did they get that housing resource when they get there, is it the right kind of resource? With coordinated access, we're looking at having multiple access points that cover the system, kind of a no wrong door approach, that folks are supported to navigate and access available housing resources that best meet their need. Now, I will say, and many of you have probably experienced, and this is part of the evolution of coordinated access, that this coordinated access picture doesn't necessarily work perfectly. You may find you're missing access points, or that more training is needed and staff is turned over. You may find that folks get hung up at a point and there's a bit of a bottleneck, or there's not enough of the right kind of resources at sort of the end of the system. But I would say, without that, you don't even know what your system looks like. You can't even ask those questions. You can't even see those bottlenecks as a community. So we're looking to coordinate our efforts. And I would say from my experience, again, where we were is we had a bunch of programs that were doing absolutely their best good work that they knew how to do. They were probably trying to connect with others and coordinate their work, but they were connected, not coordinated. When you have a shared list in your community of all the clients that are known and consenting to be experiencing homelessness, you turn inward towards the client. And I think this is where some of us are at now, but there's still more to go. How do we become more seamless and coordinated and work with people experiencing homelessness to accelerate their efforts to housing? So we were over here. I think we're here now. We're starting to focus on everyone in our community experiencing homelessness. There's still more work to do. And I think when we talk about having this list of folks in our community who are experiencing homelessness, it's important to understand this is not fundamentally about numbers, it's about people. This is about putting people at the center of our service or the center of our system. You know people by name, you know their needs, you know their assets. This information helps us to build the will from moving to a complicated, siloed program level approach to a coordinated system approach that wraps support around the people you're trying to serve and compels problem solving to address the gaps. You know people by name, you have a real-time picture of what is going on with homelessness in your community. I think that increases a sense of accountability and urgency to end homelessness for each person on the list. We can't pretend we don't know who's out there. We've collected information about folks, we're now accountable to them. And we can see what needs to happen and how we need to wrap our support around people. So let's level set a little bit on what are some of those messages or the ways we've been describing coordinated access. And I'm going to talk a little bit about the ways I think that needs to evolve. This is the Reaching Home definition right now of coordinated access. It's a way for communities to bring consistency to the process by which people experiencing or at risk of homelessness access housing and related services within a geographical area. Strong system has a housing first approach, real-time data through a by name list or unique identifier list, person-centered data, housing resource inventory, and streamlined and standardized approach, looking at access, triage, assessment, prioritization, and matching and referral. But again, we're gonna position out to you perhaps another way or some other things we should be talking about when we're thinking about coordinated access. And this is gonna look different. How this gets implemented in every community is gonna look different. And it needs to look different for different populations, for different geographies, which again, my colleagues are gonna speak about. How have their systems evolved in different communities? How are they putting a lens on kind of rural and remote communities? But generally, folks kind of move through the system in this sort of way. There's some kind of access, a first point of contact with a trained worker. And there's a triage that happens. We're definitely looking at eviction prevention, shelter diversion. Is there another safe option for folks? And if there is, that's great. Folks stay housed or they're supported towards that alternative option, sometimes accessing natural supports to resolve their housing crisis. When folks cannot have their housing situation rapidly resolved, then we're looking at how do we meet those basic needs? And what are the next steps that we need to take? How do we better understand people's housing-related strengths and needs and interests? This has been adapted a little bit from the Reaching Home Guide. I've added in some other steps that we're gonna talk about a little bit later, but you don't just sit there and wait. This isn't another wait list. This is to be action-oriented. So how are we navigating and supporting someone along their journey? How are we connecting them to other resources? How are we better understanding their needs? How are we helping them get document ready for housing, get ID, or other things that they need? Then where folks are eligible and interested as housing resource becomes available, we can take that information, we can sort through that list to find the folks for whom are eligible and interested in the housing that's available, can do that vacancy matching and referral to housing. Because the goal of a coordinated system is to rapidly connect people to housing solutions to end their homelessness. And this is just another way to think about it. I like showing lots of different pictures because I think our minds kind of, focus on different things. But a by name list is really about understanding demand and system flow. All people experiencing homelessness, those we've been unable to prevent or divert from homelessness, and understanding that system inflow and outflow data. On the other end, we really need to understand housing resource supply. What exists out there? Housing units, spaces, rent subsidies, case management spaces, rapid rehousing supports. And what of those can we get dedicated or committed to the work that we're doing together? Coordinated access is really a process to link supply and demand. And then how this works in your system, people enter in. They can't be prevented or diverted. You're adding them to the by name list. You're navigating, you're supporting, you're helping with immediate needs. and then you're using those housing resources to help folks exit homelessness. They may do that without the supports you're offering. They may find their own housing, but how are we tracking what is happening with the inflow and outflow from our system? So what are some of the benefits? I think there's system benefits, there's client benefits. As we've talked about, without it, you wouldn't know how the housing process is working or where to improve. This ability to share information between different agencies and programs to maximize resources, moving from connection to coordination. Swifter and more coordinated assistance that can help stabilize clients' condition and limit the need for other high-cost interventions. Hopefully on the client side, you're seeing simplified, consistent access to housing and supports, that no wrong door kind of approach, where they have access to all the housing resources, not just the ones that are held at one particular agency. And you're kind of lucky, you kind of happenstance, connect with one agency who may or may not be able to connect you to those other resources. And it reduces the need to repeat your personal story over and over again. How can I seamlessly support someone who comes in, who's trying to get their ID, stays at one shelter, moves to another shelter, is connected with outreach? How are we all following that person so that they're not having to start the process multiple times? But I think as we've looked to implement coordinated access, and really the federal government identified, a requirement for coordinated access in 2019. And a few years earlier, a number of years earlier, they had done that in the US as well, but there had already been communities in Canada who'd been starting to implement coordinated access for a decade or more, but for many, this was a brand new process. So I think as we've been implementing this now across Canada, there's been some misunderstandings, and there's been evolution and a need for continuous improvement. So I want to share with you what I think are some common myths and facts that we're seeing now. Coordinated access will end homelessness. So we think while it is important, we think it's a foundational element, as it can improve coordination and user experience. It can help better utilize existing resources. It doesn't magically create new resources. It can help you pinpoint where further resources is needed and be a platform to problem solve together and to advocate for more resources. It is not a magic bullet for ending homelessness. There are many other factors at play. Okay, ignore that one. We're going to come back to it. I had a little ordering mishap. By name lists and coordinated access are two totally separate things. No, they are the same thing. They're both pieces, and we sometimes work on different technical elements of both of them. But comprehensive person level and aggregate level data is a key component to coordinated access. By name list and using that, because again, it's not meant to just be a list, it's meant to action someone and support them to housing. Prioritization is new and it's unfair. 5 minutes. Okay, I just want to say people have always been prioritized. They've been getting connected, resources have been given out to people. It's just not transparent, hasn't been community-wide, hasn't been in an agreed-upon way. In order for it to work, it does need to be done consistently, equitably, and with as much real-time information as possible. Having a process to allocate limited resources is fair. What is not fair is that there's not enough appropriate, affordable housing for folks and supports. We don't receive Reaching Home funding, so we can't, or we don't need to, implement coordinated access. If you're interested in ending homelessness in your community, this is one of the things that you need to do. And you can do it without a lot of additional resources. You can begin the process for sure. And regardless of federal requirements, there are often provincial or other requirements for implementing by name list coordinated access. Coordinated access, once implemented, is complete. Check. We've got Reaching Home level coordinated access. We're done. And again, I think you're going to hear from folks about the continuous need for improvement. Homelessness is a dynamic and complex problem. Systems are complex. We're going to need to keep working on that. So We've seen some common mistakes, some early implementation issues. Some of this has been with communication. Some of it's even been with our coaching. I think in order to help folks sort of get started, we've simplified some of the messages, and I think sometimes we've lost the big picture. So there has not been enough focus on effective governance and communication. We sometimes forget about or underemphasize prevention and diversion. Sometimes communities have started by engaging shelters, and that's kind of as far as they've gotten. They lack other access points and coordinated outreach. Having only one organization involved, so a system lead or a system manager who does it all, doesn't let the rest of the community even know this is happening. It's going to involve multiple players and partners in your community. Not engaging with Indigenous partners and not understanding how to build this relationship and co-design and adapt. Only engaging system staff at the leadership level and forgetting about reaching out, having a plan, communicating, involving folks at all areas within your system. Not resourcing effectively, so people trying to do this off the side of their desk. It does take intentional effort. Challenges in explaining consent and not understanding how to do progressive engagement and assertive outreach. Thinking implementation is simply adding some technical components rather than understanding that this is a massive system transformation and change management process. Lack of continuous training as people turn over, lack of housing planning and navigation support for those on the list, over-reliance on a tool for decision-making rather than looking at information from a number of different places and using tools to assist you, not make decisions for you. Not applying housing first principles and keeping it housing focused, lack of effective action-oriented case conferencing across the continuum, and really doing it not at all, or only for matching. How do you problem solve across the whole continuum? Rigidity or a lack of dynamism and continuous improvement, and blaming the idea of coordinated access rather than the implementation of it. So I would say we need to give a bigger picture and help lift out some of the things that we've missed in the past in this system. Governance, the data system, the by name list, access, like really lifting out prevention and diversion, lifting out further assessment and navigating support, and recognizing you're going to have to implement case conferencing, you might call it care conferencing, you might call it support coordination. You need to use your data and look across and problem solve across your whole system to improve and address those bottlenecks. I'm running out of time. This presentation is going to be uploaded, but there's a number of really important things that governance does in your community. I'm seeing some people taking pictures. Just pause it there for a sec. But it's really important. How are we going to organize ourselves to do this work together? And I would say, we'll go back. One more picture. You got it? Okay. So again, and just to give, a process of how this works, we are looking to identify all folks experiencing homelessness. We're looking to add them and update the by name list, and we do this through supports that are mandated or funded to work with homelessness. That also could include a central intake, a website, a phone number, a 211, other ways you're looking to connect people seamlessly, especially in rural and remote areas. And if you don't have those services, or as you expand your services, you're looking to bring in all other partners who are touching homelessness in your community. Sometimes, though, it's hard to start with everyone. Shrink the change. Then you're looking to connect people to housing resources and house folks from those lists. How do we bring together and put in the middle of the table all of our housing units, our spaces, our subsidies, our case management support, and then coordinate together? And I won't go over this, just to say, the next one I'm showing you is sort of degrees of prioritization dynamism. And again, I think sometimes there's some things as we get started that we haven't implemented as strongly as we need to have a really dynamic prioritization process. Super static is often our coordinated access lists. Static is where sometimes people get started. You know, they collect some intake information at the beginning, They don't update that, so it kind of gets stale, and they're really they start a process and they kind of rigidly hold to it rather than adjusting as they need to in their community. So we're working to get to a really dynamic, data-informed, community-involved approach to prioritization. It's about continuous improvement, so we use a scorecard and we break it down for folks. What are the things you need to focus on first? The reaching home level, but you're not done there. Then you work on the next steps and the next steps and the next steps. We have a coordinated access toolkit on our website with lots of tools and resources and examples and information. And again, lots of examples from other communities. You don't need to start from scratch. And we know that communities are seeing progress from this work. Just an example, 40 communities have quality real-time data, 36 have implemented coordinated access that they've confirmed through us, 8 have had reductions, 1 has reached functional 0 in chronic. And again, some progress in the veteran work as well. So, thank you. Did we get it on a stick? Oh.
Coordinated access.
That's mine, the one you're clicking on right now.
Oh, you see, that's the one you've just. Okay.
That might be mine as well.
Okay.
What did you get this? What did you call yours?
Coordinated
Resilience,
access.
yeah, coordinated access,
Okay.
resilience, and changing system.
Okay. And Morrison, we don't need. Morrison was yours. Okay. So that's the one presentation that I've been given was coordinated access.
That's theirs.
No. Veteran presentation.
So this one. I'm sorry, they haven't.
Is theirs ready?
Did you get yours ready?
No, I thought, yeah.
So Dawn, have we gotten in touch with someone to help find those presentations for us?
Nobody's responded to me, only,
I went upstairs.
Yeah.
That's what they gave me.
You ran upstairs and you let them know?
so do you have the wrong presentations?
That's all they gave me. I gave them the room and the name.
So who do I contact?
Can they put-
Anybody know how to reach me?
Can they put theirs onto the stick to go next? Theirs will
Do you have it to put on the stick? Oh, great. Can you put theirs on the stick?
Absolutely.
And we'll get you-
Sorry, everybody, just be a couple of minutes here with our tech issues.
Are we getting it? Okay. We've got 2 minutes. And I was going to say, I think sometimes we let the enemy be, we let perfect be the enemy of good. It's really about progress over perfection, and I am wondering if anyone has any questions while we're just waiting for things to get going. If you want to just run, yeah, we'll get a microphone to you.
Yeah, so as you're going over coordinated access, I'm thinking somewhat about central intake at Toronto. As to my awareness, that's just, again, a central intake through this operated phone line that's, 24/7 operational. I'm wondering why there isn't a coordinated access system like a phone line available on a national level. And I'm wondering whether you believe that CAS capacity at the moment would be able to support that. Yeah.
Well, that's interesting. You're sort of saying, like, is there a number nationally you can call and say, hey, I'm having struggles with homelessness. Can you help me connect to my local community?
Yeah, like I understand that you can call 211 basically from anywhere, but like my idea of calling 211, even in Nova Scotia, is that you could call, but they'll redirect you to several different organizations rather than just one phone line. And I feel like having that one phone line that you could connect to rather than several different lines would be much easier for persons who are needing to access support.
That's an interesting idea. Sort of that national helpline kind of pool of resources. Some communities do have numbers, and sometimes those are 24/7. Some communities don't have numbers. You go to an agency, and then that agency would help connect you where you need to go. But
Yeah, sorry. So just again, like I'm wondering, like to your mind, whether or not CAS is being implemented, especially through reaching home to all the designated communities, at least that those designated communities or community entities should at least have the capacity to support this sort of looking at national coordinated access intake line. Because like, again, I'm thinking in terms of capacity building, like what.
yeah. I'm just going to sort of take that into the group as an interesting idea, right? And then, okay, some other folks. Can you go to the microphone? Otherwise, folks who are online can't hear.
Yeah, we use 211 as an access point in our community, so that solves that issue right there.
Yeah, and how does that work? Do you want to say a bit more?
It's excellent. We have I'm from Thunder Bay, we have 100,000 people, huge homelessness epidemic. And 211 is an access point, and then we work with the Indigenous CE to figure out where the other access points should be. So we have about 6 altogether in Thunder Bay, 5 in person, and 211, which is 24/7. And we do get intakes through 211. It works really, really well. And those intakes are handled differently because it's an access point. It's not a regular 211 call. So 211 is 211, but it's also an access point.
And you've had an agreement and an understanding
Memorandum
and training
of
to be able to do
understanding,
that.
everything, yeah, just like every other organization that's an access point.
Yeah, great sharing. You had one.
So first, thank you for the presentation. I think it was grounding, and even just the one point on the myths and facts about where it's like, prioritization has always been happening. It just wasn't happening with transparency. I think that's really important to remember. Sometimes when we face criticism, is that it was happening. Decisions were being made just without us all coming together about them. Yeah. But I had a question about thinking bigger in the future of coordinated access, because I've seen rumblings between communities where they'll say, you'll see a news article where they'll say, 300 people have come to our city this year from another town because they were told there were shelter beds. And I don't think anyone's doing that maliciously. I think we're all trying to support people and find where there might be a bed. But it shows a gap that we're coordinating, so I'm from Hamilton, and we're coordinating Hamilton, and Toronto's coordinating Toronto, and London's coordinating London, and it's awesome, and I love the work, but then we see these gaps. So has there been any consideration about the next phase of coordinated systems between communities and where that might be going?
Yeah. Again, I'm going to put that out as a really interesting idea, right? Yeah, I don't know. But yeah, the future, does it look even more seamless and seamless between communities as people move around? It's a really important point.
Hi, I've just got a question about the real-time list. So our coordinated access in our area, our communities, is relatively new. And so the coordinated access worker, she is developing the new by names list. I'm the housing locator, so I have the by names list, but it's really just focused on housing. So my question is, how do we keep it real time? How do we do that? Because there's a lot of names on the list, and how are other coordinated access workers doing that?
I'm going to turn that first to the wisdom of the group, because I know in your communities you're doing certain things. How do you keep sort of that information on your list not getting stale?
I can bring a microphone over to you as well if you want to respond.
Do you use HIFIS at all? Yes. Okay. So like I'm in New Brunswick, and we are right now, we had our by name list on an Excel sheet, and about once a week agencies would kind of send me their batch updates, and I would do them in batch updates. That takes a lot of time out of my work, and I think as a coordinated access lead, it's like not the best use of my role. So what I would recommend is like use HIFIS to generate your by name list. Talk to people who know HIFIS. I can get you connected if you want to find me after, but hi, oh, I'll stand up. Hey, my name's Lee.
Hi, we are working with HIFIS on the list.
Okay.
We're working in connection with them. They're actually in partnership with them as far as the list is concerned, but it's about how do agencies get the information to get the list updated, you know, because it's, you know, is it, yeah.
How do they like make time for it, you mean?
In Thunder Bay, we actually hire someone. $70,000 a year, pays for the coordinated housing access lead. It comes through CCI funding through federal government. But yeah, before that, we had nothing in place. We need $150,000 a year to make sure coordinated housing access runs in Thunder Bay annually. And if we can't get it through CCI, we're going to use Reaching Home funding to make sure it happens, because otherwise, we have no coordinated housing access in Thunder Bay. That was the clincher, money. That's how we did it, by hiring a full-time person.
Yeah. And so that's one way, and it's, yeah, absolutely, that idea of like, we're going to have, you know, every time someone sort of comes into contact, are we updating HIFIS, are we sending the information so that we can get, you know, our by name list updated. Sometimes communities and smaller communities, they've done outreach blitzes. So we kind of pull everyone together once a month and we do a bit of a blitz. So like, I think there's lots of different creative ways that people have done the best they can within the resources that they have. Start where you are, do what you can with what you have.
We'll hold questions because I believe we are ready for our next presenter. And just while they're figuring that out, I want to let everybody know there is a microphone, like a standing microphone here for anybody that has questions. But if you do prefer, I bring you the microphone. Just raise your hand when we do questions. And also, if you're going to respond to a question or add to it, it would be great to do it in the microphone so the whole room can hear, but also so that it gets recorded and so that your information is shared out to everybody.
I just wanted to add, while we're waiting for Ashley, someone had mentioned 211. We are a national organization, but Sydney and I are situated in Alberta. I don't know what it's like in other provinces, but not every community has access to 211 in Alberta, and specifically on reserve. It depends if you have a TELUS line or not. And so just something to think about maybe in some of the more northern and remote and Indigenous communities, that, like, it's a great resource. It is a great resource. But in Alberta specifically, I don't know about other provinces, but in Alberta specifically, not every community has access to it. And we find that a lot of our on reserve don't have, because of whatever telephone line they have. In Alberta, it has to be TELUS. And so that's just something to keep in mind too, if you're recommending that, to make sure that the people have access to that actual resource when you're providing it to them. And once we get started here, The other thing I just wanted to add, there was some conversation about some case management systems and coordinating them and stuff. And I know one of the things Sydney is going to talk about is a great resource to have. But I heard somebody else mention that it costs money to just hire somebody to kind of focus on that. And that's what we're finding in a lot of, across Canada, in a lot of the rural and remote communities where we did our research, is that there just isn't that capacity and funding available, because reaching home works different for rural, remote, and on reserve streams outside of the bigger cities and the national ones. And let's turn it over to Sydney now.
Perfect. Thanks, Linda. And I swear we uploaded our presentations on time. But yeah, we're bonding over IT issues today. So my name is Sydney Senekis. I'm the Director of Homelessness Initiatives with RDN. I've been with RDN for about 4 years now. And I'm here with my colleague, Linda Bernicki, who's our Director of Community Development and Indigenous Engagement. And initially, Linda and I were going to present together, but she had presented yesterday, so I told her she could take the day off. But feel free to ask her really hard questions, because she brings an extensive wealth of knowledge from her frontline experience, so I thought it would be really important for her to be here today. Now, before we get started, I just want to take a moment to acknowledge the many First Nations, Métis, and Inuit peoples across Turtle Island. As a national organization, we acknowledge that we are all treaty people. And we want to take the opportunity to reaffirm our commitment and responsibility to improve relationships between nations and to improve our understanding of the vast differences between the many Indigenous peoples across Turtle Island and their own unique cultures. And now to start off, I just want to tell you a little bit about the Rural Development Network. Linda had spoke about who we are a little bit already. We are a national non-for-profit organization. Really, some of the key ways that we work with rural Canada is we create innovative tools and resources, including guides, toolkits, and training materials. And really, these things are created in partnership with rural communities and Indigenous organizations. And as well, we provide expertise and boost the capacity of rural communities to implement their own projects. In addition, we really advocate and seek to amplify the rural voice and help connect people to resources and information through various events and networks. And we seek to support groups with accessing funding, which is obviously a huge barrier for a lot of smaller communities. And I am just curious, for folks in the room here, who is representing a rural community or an Indigenous community? We have a few folks in the room. Oh, that's great. Awesome. So we've been committed to addressing issues in rural communities at the local level, and our initiatives really evolve and adapt based on the local needs and priorities of the communities that we work with. So we administer the federal government's Reaching Home funding to rural, remote, and Indigenous communities in Alberta. However, the Homelessness Initiative has really grown over the last few years to support communities across the country in responding to homelessness through community education and engagement, our National Coordinated Access Project, which you'll hear more about today, as well as data collection, specifically our Housing and Service Needs Program and First Nations Data Collection Project. So before diving in to our Coordinated Access Project, we just wanted to touch really briefly on our housing and service needs estimation work, as all of our work is really interconnected and has informed essentially our desire to want to support communities in implementing coordinated access. So our housing and service needs estimation work, we essentially work with rural, remote, and Indigenous communities to help communities collect data to better understand what homelessness looks like in their community, housing insecurity, and as well service needs and service gaps in their community. So as many of you know, homelessness by national definitions involves a spectrum, and it's not just people living on the streets or in tents. It includes people who are couch surfing, are staying in emergency shelters, have folks who have shelter but maybe don't have heat or electricity, folks who are sleeping in their vehicles or abandoned buildings, or are living in domestic violence situations. So we recently completed a province-wide housing and service needs estimation in rural communities in Alberta. We worked with 21 groups that represented about 45 rural, remote, and Indigenous communities in Alberta this past spring. And this survey was administered through local service agencies. And what we found was quite surprising, maybe not surprising for those of us who work in this sector, but we found that 7,320 community members were determined to be experiencing some level of housing insecurity in rural, remote, and Indigenous communities in Alberta. And obviously this number is a lot higher because we did not work with every single community in the province. So based on these findings, we've put forth a set of recommendations, many of which speak to more regionalized approaches to coordinated service delivery and coordinated access. And so I thought it was just important to mention this work because it really has informed where we've gone with this project. And so as homelessness continues to rise in communities across the country and at per capita rates in rural communities that are comparable or if not higher in comparison to urban per capita rates, it's really becoming increasingly important for communities and service providers to work towards more coordinated approaches to service delivery. So in early 2022, our organization had the opportunity to work with a lovely University of Alberta graduate student, Rachel, to do some initial research in Alberta on coordinated access and really gauge service providers' level of knowledge and really begin to build a shared understanding of what coordinated access is. And some of you might be surprised to know that when we actually asked service providers what they knew about coordinated access, a lot of service providers in the rural communities we were working with said they had never heard about coordinated access. However, when we started to change the language around it, they realized that they're actually doing a lot of informal coordinated access already. So it was really interesting once we started to change the language around it, how engaged service providers became. So as you can see in this diagram, folks accessing services must navigate a really complex system. Marie touched on this. And without coordinated access and collaboration among service providers, folks often get the runaround and experience many barriers in accessing the services that they need. So based on engagement with service providers in Alberta and across the country over the years, there are a number of consistent challenges pertaining specifically to rural, remote, and Indigenous communities that consistently keep coming up. Of course, the limited and inconsistent funding that's available, the lack of services and housing options, transportation barriers, lack of mental health and addiction supports, challenges in general for smaller communities to develop culturally appropriate responses to Indigenous homelessness, obviously, of course, outside of Indigenous communities, community engagement and education, including NIMBYism, and overall just the general capacity due to staff turnover and burnout, which has been mentioned quite a bit this week. And in addition, folks also lacking the capacity or the knowledge to collect their own data, which is also a really important component of coordinated access. So despite these challenges, service providers also noted a number of opportunities and strengths that put rural communities in a really unique position and a good position to respond and implement coordinated access. And obviously, in smaller communities, communities are really close-knit. Collaboration is deeply embedded in a lot of rural communities. Of course, you know, there's some communities where there might not be that collaboration or maybe those interagency meetings and coalitions and task force. But in a lot of rural communities we work with, we've seen over the years an increase in those kind of more, I guess, formal task force and coalitions being developed to respond to issues of housing and homelessness, which has been amazing to see. As well, of course, dependent on the community, we worked with a number of communities with really strong community leadership and local champions. And as a result, great minds have come together to develop some really innovative solutions to respond to homelessness. Some of you may have heard in Alberta, there's been a shelter pods model that a couple of rural communities have adopted to shelter their most vulnerable residents. As well, I kind of touched upon the informal approaches that rural communities are using for coordinated service delivery. And as well, and I'm sure this is no surprise, but service providers in rural communities really value that relationship building piece with clients and that client-centered approach. And in addition, for a number of smaller communities in a larger geographic region, there's opportunities for regionalized approaches to coordinated access. So building off of previous work, and thanks to the federal government, in 2022, we received Reaching Home CCI funding to carry out a national coordinated access research project. And this project's main goal is to create a guide for rural, remote, and Indigenous communities to develop and implement coordinated access that is really adaptable and scalable across a number of communities. So to kick off the project, we first completed a literature review and environmental scan in the last year. In the last year, our team has been researching and engaging with communities, service providers, and those with lived and living experience on how urban coordinated access systems can be adapted to rural, remote, and Indigenous communities in their contexts to meet their unique needs and challenges. So the focus of this presentation today is really to share some of those learnings. And those learnings are currently being informed right now, are currently informing the development of a toolkit. And then participating communities, specifically in Alberta, are first going to pilot our coordinated access kind of toolkit in early 2024 and provide feedback before the project finishes in March of 2024. We're also seeking feedback from a variety of stakeholders. However, we're hoping to seek out more funding as well to really continue to expand on this work and pilot this toolkit and this model in other communities as well outside of just Alberta. As I mentioned, this is a national project. So in the past year, we've had the pleasure of visiting 3 communities in person, 1 community in Alberta and 2 in Ontario, and we've hosted 10 virtual focus group sessions. And so in total, we've engaged with about 105 service providers and 80 people with lived experience. And we've specifically engaged with service providers in British Columbia, Alberta, Saskatchewan, Manitoba, Ontario, and Nova Scotia. And we've worked, what's cool is we've worked with communities who currently don't have a coordinated access system, and others who are further ahead on their coordinated access journey, and so that's really allowed us to have some really interesting insights. So what we've learned from service providers when we've engaged with them, in smaller communities, there exists a lot of prejudice and discrimination among landlords and law enforcement. Of course, this isn't every community, but this was a message that we've heard in a lot of our engagement sessions. What we need to consider as we're developing the toolkit as well is some of those confidentiality and privacy concerns. And data sharing between service agencies, that was brought up in a lot of sessions in smaller communities. Communication and access to technology, especially in those remote communities, continues to be a huge barrier, and not all clients have the means to stay connected with service providers or apply for necessary income assistance because there's limited access to phones, computers, and internet. Again, burnout and staff turnover, I don't think we can say that enough in this sector. And a lot of service providers have noted that they've been unable to do these big picture things, as well as wear their multiple hats that they wear in the community and work to serve clients. We've also heard loud and clear that community members and service providers, they need support with helping gain that buy-in in community for coordinated access. So that's something that we're working on with the toolkit, is providing some of those resources for folks to start to work towards building that buy-in. And then the big one, which we're extensively focusing on in the development of the toolkit, is really that training and capacity building piece. Folks have communicated to us loud and clear that training is needed prior to being able to even move forward and consider those steps that are so important in implementing coordinated access. And so training surrounding cultural competency, unconscious bias training, substance use, and mental health sensitivity. Rural communities are constantly asking us, how can we engage with those with lived experience? Like, what are the appropriate ways of doing so, and incorporating and ensuring that their feedback is informing their policies and their programs. We've heard a lot of need for training around just strategic planning in general and applying for funding. In terms of systems and processes, there's interest in training surrounding case management and client management tools and data collection. In addition, there's interest in service mapping and mental health support for frontline workers and team building between agencies. So as you can see, there's no shortage of training and capacity building that really needs to take place in order for coordinated access to be successful. Now, most importantly, what we've heard when we've engaged with those with lived and our living experience of homelessness and housing insecurity was there are a lot of barriers and limited access to services in rural communities, including basic needs and access to food and washroom facilities at night and 24/7. There's barriers to access to technology, as I mentioned, which came up among service providers as well. There's barriers to accessing income assistance, which we could have a whole session on. There's barriers to healthcare and mental health supports, including financial penalties for any missed appointments. There's no public transportation, as we've heard already. There's no housing options, or there's not a variety of housing options. Folks also noted that there's a desire. They want to work. They want increased employment opportunities, and they noted that jobs are so much easier to maintain when they have a roof over their heads and when they have a home that they can go to. They also talked about the really long wait lists and the fact that there needs to be more staff and social workers available to support them. They also talked about having to leave their home communities, that forced migration, and having to go to new communities and leave their social networks in order to access services. Folks talked about feelings of shame and being judged in their community because of the public perception of homelessness, which we all know too well. And then the one really interesting point that I felt when I was learning about what came out of these engagement sessions was that folks with lived experience, they see the breakdown, they see the disconnect among services and service providers in their community. They see that service providers are often working in silos. And there was a lot of confusion around, where they should go or where they can go to access specific support. So I thought that was really interesting because oftentimes, at least when I was, thinking of coordinated access, of course I'm thinking about the impact that coordinated access has on individuals and those accessing services, but it was really interesting just to hear directly from those with lived experience that they're seeing the breakdown as well, and they're seeing the barriers that not having a more coordinated approach is imposing on them and their livelihoods. So we have a lot of incredibly valuable information from the engagement now that we have done with those with lived experience and service providers. And so now we're bringing it all together, like I said, to develop this toolkit. And when we asked folks what they would like to see in their community regarding coordinated access and really as an outcome of coordinated access, they talked about there needs to be alternatives to current assessment processes and, specialized consideration for, case management and assessment processes. They talked about how they really want to see essentially opportunities for information and resource sharing between large geographic regions and even maybe at the national level, especially as they're continuing to move along their coordinated access journey to really share learnings among each other. Folks talked about the increased need again for training for service providers and community members, including elected officials and landlords. The list goes on. They talked about the hope for increased housing and services available in their community. They talked about the need for, again, that buy-in piece, and that includes mainstream services, the need for increased collaboration in order to reduce silos. And finally, and ultimately, what's so important about coordinated access is we want to prevent that re-traumatization for the client in terms of them having to retell their story over again, and really, ultimately, we want more efficiency within service provision. Perfect. Okay, awesome. So we've heard, like I said, loud and clear from service providers and those with lived experience that coordinated access is needed everywhere, but it must be flexible and not prescriptive. As I mentioned, we're in the process of writing a toolkit and trainings to share with service providers across Canada. And in the new year, the toolkit and trainings are going to be piloted in a minimum of 5 communities in Alberta. If you're interested in getting involved with the project, if you're interested in learning more, I encourage you to ask us questions, and you can connect with us after the presentation as well. But yeah, thank you so much for your time, and yeah, really looking forward to the discussion and connecting with you all. Thank you.
Pull it up, I'll get it set up for you. Which one? Oh. Is this it? Okay. Can we just download it? It's not downloaded? No, because you just opened it. Can we do that after? Do you need it? No, I need it to give it to the interpreters.
Thanks for everybody's patience. We're just downloading it. Just take a moment.
Is this it? I'm not sure.
Sorry, may I ask just a question while we're kind of waiting for this?
Absolutely.
Just again to kind of iterate my point, if there are any representatives here from... Sorry, yes. This is kind of a general question. If there happens to be anyone from Infrastructure Canada or Reaching Home in the crowd, just again, like, what is the capacity at the moment to support more of a CAS system that could work as like a central intake on a national level? That's kind of what my interest is, and it sounds like certainly with rural, remote communities, that would be hopefully supportive to those communities as well. And just like if anyone has maybe kind of an idea of again what the capacity actually is at the moment, that would be helpful for my understanding. And sorry again, I forgot to introduce myself at the start. My name is Collins Ellison. I'm currently working through a grassroots organization, Housing is a Human Right. We're kind of working in Nova Scotia at the moment, advocating for the provincial government here to adopt a central intake similar to central intake in Toronto. And again, to my understanding, at least based on direction from the Affordable Housing Association, which is the main community entity here in Halifax, we do have the capacity to support central intake. It's just, it would take more government support. So I'm wondering again, where Reaching Home or Infrastructure Canada is at with that in terms of providing that support. Excuse me.
Do we have anybody from Infrastructure Canada that would like to answer? I'll bring the microphone.
Hi, I'm Angela Pye, and I do work for Reaching Home and Infrastructure Canada. So if I'm understanding, I sort of think of coordinated access, there's the two components. I'm hearing you talk about coordinating entry, so that first point of access, and then, but then there's also like the tech component, right? So maybe I could just speak a little bit to kind of where we're currently at, and then, kind of just take your note and kind of like we can talk further after. But generally, our kind of general orientation is you kind of organize your designated community area first. And so if we have like adjacent communities, we encourage them to like partner up with that designated community, both even in terms of access to HIFIS, so in terms of granting licenses. We love to see kind of the more the merrier, and in some cases we have multiple communities partner up and use the same instance. So from a tech point of view, which is very supportive of coordinated access, it's lovely to begin with the end in mind. And I think from, you want to sort of think about, okay, well, how might we be able to support one tech solution? So again, the HIFIS answer is, bring friends, right? Here's HIFIS 4, bring your friends. So, partnering with the designated community around that kind of makes sense. Then, if it's in terms of coordinating access outside the designated community boundary. I think that's like a conversation that we could, sort of just reach out to the different funded partners. And certainly we always love to support the networking and the coordination and, shared resources in terms of even standardizing access questions, right? So that the minimum is, well, how could we shrink the change and talk about asking the same kinds of questions in a similar way to kind of prepare for that broader kind of coordinated service. So 2 answers. One, the HIFIS is typically working with the designated community and then kind of adding on, and always can give you connections to those. And then the second is shrinking the change around coordinating service delivery and thinking how might we partner up some of those questions at intake, shelter diversion, working with 211 partners, and really just trying to, because that in and of itself is like a big leap. And maybe through those conversations, you can kind of get to some of those further kind of bigger aims that you're looking for.
Yeah, absolutely, and I wanted to kind of suggest again, like to the presenter's point there of 211 not being accessible to a lot of rural remote communities. Like definitely some type of toll-free number like could be accessible throughout anywhere within Canada, to my mind at least. And again, to your point as to how HIFIS it works in coordination with CAS systems to sort of support community building. Like just even for example, here in Nova Scotia, there are, to my understanding, 3 community entities. There's the Affordable Housing Association, which is responsible for Halifax as well as rural and remote regions. There's I think Catlin's Place Society. Apologies if I didn't pronounce that correct, but that's responsible for Sydney, Cape Breton region. And then there's the Big Ma Native Friendship Center. So to my awareness, at least through the kind of research that I've been doing, all of these community entities operate within the same CAS system. That's the by name list. And so they also, to my understanding, all utilize ARH4. So there's no reason as to why these community entities, all 3 of these community entities, couldn't work together again to support this operating system. And actually that is sort of a direction that I've got, again, as I suggested before, from the Affordable Housing Association, that again they do have capacity to support this. It's just, again, where's the government support for this? So I appreciate kind of your reflection on it from Reaching Home's perspective in terms of providing designated fundings to specific communities, but I think in more of a broad sense, it would take more of a kind of again, larger scope from Infrastructure Canada to kind of narrow down like what can be done as opposed to what is being done.
Thank you.
Oh, I'm so sorry. Yeah, I'll sorry if I had to exit actually, but maybe I'll just.
Thank you very much for your question. We're going to carry on with the final presentation.
Hello, everyone. I'm going to try to get through this as quickly as possible, so we still have some more time at the end for questions or some one-on-one chats. If I go through it too quickly, just let me know. So I'm going to speak on coordinated access, resilience in a changing system. So I'm speaking from Grand Prairie, Alberta. So we're kind of the hub of the Northwest Alberta, home to nearly 70,000 people. However, it's not on the next slide. Perfect. No. I'm not meant to present, so that's okay. I was really nervous if I wasn't before, I am now, so. Good Lord. Where'd it go? I can just read.
See if it's staying open.
I have that on my phone. Yeah.
Where did it go? See it there.
Did we get it? Okay. Slideshow from beginning. There. Now we go. Should be good.
Okay, I'll try again. So I'm speaking from Grand Prairie, Alberta. So like I said, we're the hub of the North, home to nearly 70,000 people, but we do service nearly 3,000 just because we are that service hub for the whole North and the Peace region. So our community is oil and gas and farming and forestry and we currently receive about 5.98 million annually to address homelessness in Grand Prairie. And centralized access for over 10 years, 3 years focused on coordinated access. So this is a quick housing need snapshot of our community. So there's 2,500 households identified as core housing need, 725 households on affordable housing waitlist, estimated 188 place-based supportive units that are needed in our community, 511 individuals on our 2022 and 2023 by names list. Our rental market is relatively affordable at this moment, however, it's very unpredictable in Grand Prairie. So our coordinated access reach, we currently service 140 scattered site caseload for adaptive case management, 16 youth housing first caseload, which is brand new to our community for youth housing first. That just came online this year in 2023. Housing loss prevention available to renters and homeowners. New in 2023, we have 81 supportive units. For low to high intensity, we have additional 42 units coming on next year to do a phased approach. We have 24 independent living units. We'll have 11 transitional spaces for youth coming online right away as well, and then 36 pre-existing community units that are now supported by prevention and supportive housing staff. So this is our coordinated access story from May 2020. So we conducted an evaluation of current centralized access program and found issues arising from non-transparency, centralized decision-making, and a very non-collaborative approach. We then developed a model for coordinated shared decision-making and a service delivery model. We reviewed data to assess positive and negative impacts to ensure the transparency. We improved service provider relationships gained by buy-in and collaboration with the service providers, and ended centralized access program contract and replaced it with a community-based housing hub table. We really focus on the transparency part of the decision-making and just really working with like-minded agencies in our community, and bringing back that collaboration was huge. Process improvements included, we went from one organization making all referrals, all decisions for multiple supportive housing programs, all participant programs only participating because they were required to by the funding contracts, participants needing to go on one single location to access housing services, and stakeholders having relatively little say in all the processes. We have several organizations made referral decisions for multiple supportive housing and outreach programs, partners who are participating optionally as collaborative approach, as well as partners funded, all working together in a common goals and agendas. Participants now have staff available at multiple locations throughout the city to provide housing access, and we have collaborative feedback coming back to us every 6 months. What happened next? So we achieved savings alongside a vastly improved service within 6 months. So we went from $388,000 annually to $80,000 annually. Decisions, again, made by that one single organization to decisions made by a housing hub table as a collective. So everybody has a say in the decisions. All assessments completed by one single organization, and now multiple partners throughout the community. We're really going to the people versus the people coming to us. Our wait time went from 76 days down to 7 to 14 days for referral, and 50% success referral to 70% success. Presented challenges. So of course, over the last couple of years, there's constant challenges. So we really had a hard time with staff turnover, the change in the municipal office. With that, we then branched off into our own department for housing and homeless initiatives. So now we can really focus on rebuilding those relationships, really getting out to the community, repairing broken relationships, community, having that transparency back as well. A change from 100% scattered site program, which was expected. However, we had significant delays due to shipping costs, shipping delays in the community. leaving a program gap. Loss of soft program elements that created that momentum, so personality and experience, skill fostering, collaboration, and ability to adjust changing sector landscape. We returned to old wait times and old referral success rates. We lost some unfunded partners that were optional at our housing hub table. They lost interest. Decisions based on inflexible concept of prioritization that wasn't adjusted to meet our community needs. Where we're at now, so 6 months of hard work has returned our wait times back to 1 to 2 weeks. We're generating renewed interest and participation through conversation, collaboration, so really getting out there, hitting the ground running, really building those collaborative relationships in the community. Making adjustments to increase equity, responsiveness, and protect against turnover impacts, revisiting formal agreements, roles, and responsibilities. I think that's a huge one as well. Really, as they had spoken in their previous slides about that continuous evolution of change that's always needed. You always have to come from it with that lens and just know that there's change needing in the community. New online, we have place-based supportive housing and transitional units that are open. Again, that's the 86 units. Working together to provide access to non-funded housing programs and include them on all decision-making. So again, just reestablishing the partnership throughout the community. And that's it. So summary thoughts. A program won't be successful forever or for very long based on a rigid format. So again, really looking at that processes and really evaluating in the community and really getting that the frontline experts feedback for that change that's needed and recognizing that, you know, not to keep doing that continuously. A successful process cannot be sustained by how-to documentation alone. We really need the experts, which are the frontline workers. Truly need the right people at the table, so the like-minded agencies build trusting relationships, lead and excel in discussions that respond to community need, really being solution-focused, create an environment where people are comfortable offering ideas and solutions and being transparent, again, in decision-making. We just need to know the difference between a program that may need adjustments and a program that isn't working. And that is all. Unfortunately, I didn't have an end slide with my contact information as well because I'm brand new to this. But I do have business cards, so you can come up and get them if you need. Thank you.
Thank you to the presenters for your patience with the tech issues, and to everybody for the time it took to get it resolved. We will proceed with some questions, and just a reminder to speak into the mic that's standing or put your hand up so I can bring you the portable mic.
Hi, I'm not sure if I've got a question in here other than how do you react to the statements I'm going to make? I'm from a small community, and we've been dealing with a huge amount of homelessness in a relatively small community of about 10,000 people for a lot of years, and are wrestling now with how to interact with this notion of the CAA process. And one of the situations we're in, we're planted pretty close to some urban centers that are working hard to do this CAA and are definitely wrestling with this notion of being taught by our urban neighbors of how to do this work. And one of the things that, you know, I think every rural community might be a little bit different, but I think very favorably about the work that we've been doing, and I'm realizing that coordinating access to services in a coordinated way is just what we do. And this is what my experience is what small communities do. And this creation of CAA, I have an opinion that it's an urban created thing, and it's been out of necessity. I mean, the urban centers have been the centerpiece for dealing with homelessness, and it's a lot of complex communities, lots of service providers, lots of different services, lots of need to do a lot of coordination. So that whole notion of coordinating the services is priority number one to really make sense of it. In our small community, that would probably be priority number 33. Way down the list, because that's just stuff that the small communities do. And if anything, the urban communities could learn from small communities rather than the other way around. So as we're being taught how to do the coordinated access, we've been kind of brushing up against it, because what we've been finding was that as there's been some imperatives from some of our funders, we've seen subtle shifts so that the coordinated access becomes more agency-centric rather than person-centric. And it's coming from a situation of how do you organize multiple service providers in a complex area to deal with lots of multiple needs and that kind of thing. And it's imposing something that wasn't needed to start with. And actually, we had it nailed. And in a lot of ways, not to say it was done perfectly, but I guess if anything, I'd love to see this notion of coordinated access not be treated as if it's a universal given. I think it's a creation of something that was very necessary in very complex service environments, and that in a small community, it's not about scaling that down whatsoever, because rural communities, I think, are very, very different kind of places and don't have the necessity to do that in that particular way. And in some ways, some of the trappings around that are unnatural, and the resources that we're needing to be putting into it are actually, when truly look at it, a lot of the resources we're putting in is how do we make what we do recognizable to the urban world? We'll do it with the way we've always done it, but now we need to do it in a way that they'll recognize it. So I'm not sure what your thoughts are around that one, but.
Thank you. Any response or comments?
Without knowing enough about your community and that sort of unique situation, I think every community is unique, and I think you're right. I think there is really something to be learned from smaller communities where they are often de-siloed. Like, all the people are sitting next to each other and have good relationships and know what they need to do, and that's the strength of smaller communities. Often there's less resources. Sometimes in larger communities there's more resources, but there's more, specialization, siloing, that sort of thing. So yeah, I mean, I agree with what you're saying there. I think every community has something to learn from other communities, and certainly smaller communities have often got the relationship and connection piece nailed well.
Thank you, Maureen. We have about 8 minutes left, if anybody else would like to ask a question.
Thank you. So I just have a question about prioritization, and there are lots of tools out there at the moment. We've all done the training on the VAT, but some agencies that will work for, but it won't work for other agencies that work with youth. And I'm just wondering if those that have the toolkits have got a preference on particular ways of helping to address that and get, a tool that's going to fit a good broad demographic for prioritising.
So, I think as communities kind of rethink and re-examine what they're doing with different tools, like, we're really bringing it back to the basics. What are common questions that you need to ask? How can you ask as few questions as possible and be as least intrusive as possible at the beginning of the process? And as you continue to work with someone and they remain in the system, you can add in additional questions over time. And to think with the end in mind. What are we trying to prioritize in our community, and what kinds of questions must we have answered in order to be able to do that effectively? And I'll give an example. If you have a mental health service that has spaces for someone and they have something they need, someone needs ID, somebody needs a connection or a letter or a document, what do we need to get up front in order to help that person move as quickly through the process as possible? I think you do need to consider different population needs. And again, that's kind of, at the end of the day, if we're trying to prioritize youth, what kinds of questions do we need to ask youth in order to understand that and to do that effectively in our community.
Thank you. Any other questions? We have two. I'll come here first.
It's not really a question, it's just a comment. Speaking to what you were responding to the question about 211. Likewise, I live in a very small rural community in Alberta, and we're up against the foothills, which means we're like at the end of the highway before you hit British Columbia. So, and our neighbors are often from 3 reserves. And so the folks that I then would see at the hospital coming off of those reserves often don't even have a telephone, or they only get access through Facebook or Messenger or texting only, because that's all that they can afford in terms of a program. So I think if we're going to talk about like a national kind of access point, we need to remember that not everybody has the kind of flip or money to be able to afford the technology that so many of the rest of us rely upon.
Any comments, response?
Just that, I mean, we totally agree, because that's what we see and hear all the time, and it's just not that, it's also bandwidth. It's just not available in a lot of the rural, remote, and Indigenous communities. And so if we're relying on technology to be able to access services, there's going to be a whole group of people that are going to continue to cycle and just miss out because they just can't have that access.
A good reminder that it's not a one-size-fits-all. Somebody else had a question.
This is just a question about what you folks know about data or supports looking at migration between communities. So I work with several small communities that surround a hub, a larger center, which is actually then a remote community to another hub. And so one of the curiosities that we have right now is whether or not there's any research that's been done to look at migration patterns between small and medium, rural and urban kinds of communities when people have to move to access supports, and then if there is a resulting increase in homelessness because of the need to transition for supports.
What province are you from?
BC.
BC.
But I mean, it works in many places.
No, yeah, for sure. So there has been some research done on that, and some of the research speaks to exactly what you're saying, right? Is people moving from rural, remote communities into bigger urban centers to access services because they may not have the services available. What happens a lot of times is then they even get that much more pushback and cycle even more so because they don't have natural support systems anymore that perhaps they were depending on in their smaller community. They don't have smaller service offices that they could go in for harm reduction and just have coffee and have a meal. They don't know where to go, and they get lost in the system in the streets of the bigger cities. I can't quote any of the research off the top of my head right now, but after, if you want to come grab our cards, we do have some research that that supports some of the information that you're saying.
Thank you. We have time left for, oh, sorry, go ahead.
Do you mind if I just add on a little bit? Yeah, I know I completely echo what Linda shared. I was just also going to mention, so I talked briefly in the presentation about our housing and service needs program, and that's something, or that data is what we're really interested in collecting through that particular estimations, and we're starting to work with some really interesting rural communities that are, circulated, really close by to urban centers, and so we're trying to do some brainstorming right now with how we can better collect that data for even folks who are just going in like temporarily to try and access services in urban centers. And then as well, I noticed Patrick's in the room here, and I know there's been some great research done by his team on migration patterns based on the point-in-time counts. And so, yeah, if you're interested in that, maybe, yeah, Patrick could connect with you and his research team. But yeah, there's a lot of great research that's recently been done on that.
Last question, I'll come right over.
Hi, thank you so much for your presentations. I was really glad to hear coordinated access being sort of couched within some of the challenges that communities can face, and also described as not being a silver bullet, that there are a lot of other pieces to addressing homelessness. And I just wanted to give an example of where coordinated access is not working well just yet, and that's in our community in Peterborough, where less than 5% of the people who are on the by name list actually got housing through coordinated access in 2022, but about 7 times as many got housing through other means. So our community has some work to do. I was glad to see all the mistakes that communities can be making, and definitely there's a lot of different ways that people can approach coordinated access, but I wanted to put that out there just for communities who might also be struggling, that you know that you're not alone, that there are a lot of challenges that can happen with coordinated access, and definitely we've experienced some of them.
Thank you.
Before we wrap up, I just wanted to really give kudos to our presenters. I don't know if everyone knows, these were not all of our original presenters. There's been staff changeovers and people that couldn't make it. And of course, presenting is stressful, and then when you're having tech issues and you're worried about getting set up. So I just really wanted to give these folks an extra big round of applause.